MedShake. Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, we're going under the hood of an AI-driven breakthrough in cardiology. Researchers have developed a model that can take a single ECG and predict not only the presence of heart disease, but also long-term mortality risk. How does this work? What data powers it? And most importantly, can we trust it? Let's break it down. Welcome into the MetaHealth. Electrocardiograms, or ECGs, have been a staple of cardiology for over a century. They record the heart's electrical activity and help doctors detect abnormalities. Today, doctors are experts at interpreting ECG results, providing very important diagnosis for immediate heart conditions. However, scientists wanted to take this further, to give these doctors the ability to predict cardiovascular risk up to 10 years in advance. By leveraging AI, they aimed to transform the ECG from a diagnostic tool into a predictive one, offering insights that could shape preventive care before symptoms even appear. Researchers at Imperial College London and Harvard Medical School developed an AI model called the AIR platform. Unlike traditional models, AIR doesn't just say whether your heart is healthy or not. It predicts your risk of dying or developing serious cardiovascular conditions over time. But how do you train an AI to read an ECG? This is where it gets fascinating. The AI wasn't trained just on a handful of ECGs. It learned from a massive dataset of over 1.1 million ECGs from nearly 190,000 patients. These ECGs came from a hospital in the US, forming the backbone of the training process. The AI used supervised deep learning, meaning it was trained on labeled datasets, where each ECG was paired with real patient outcomes, such as whether someone developed heart failure, had a heart attack, or even died. This approach allowed the model to learn from past cases and recognize patterns that correlate with long-term cardiovascular risk. Now let's talk about the science of validation. How do we know that it actually works? It's one thing for an AI model to work in the lab. It's another one for it to work in the real world. That's why the AIR model was tested on 5 external patient datasets from different countries. The UK Biobank, which is a dataset of volunteers in the UK, the CODE dataset, which is primary care patients in Brazil, the SAMI-TROP cohort, which is again patients with chronic diseases in Brazil, the ELSA Brazil cohort, which is public servants from Brazil, and another US-based dataset. The results? AIR demonstrated strong predictive accuracy across all these diverse populations. Importantly, its predictions remain consistent across different ethnicities and healthcare settings, reinforcing its potential as a global applicable tool. One big reason people fear AI in healthcare is the black box problem, the idea that AI models make decisions that no one can understand and explain. The researchers tackle this by making their model explainable through multiple approaches. They use a technique to identify key ECG features linked to risk, such as QRS duration or T-wave abnormalities. They also compared AI predictions with traditional risk factors and performed genetic analysis to validate the biological basis of the model's outputs. These steps ensure that AIR's prediction was not just accurate, but also interpretable and grounded in known medical science. In fact, they found that AIR's predictions were linked to well-known heart risk factors, like enlarged heart chambers, poor R-wave progression, and abnormal QRS durations. They also performed genetic studies showing that the AI's predictions correlated with genes involved in heart disease. This means the AI isn't making things up, it's actually detecting real, biologically valid signals. So what does this mean for the future of medicine? AI-ECG isn't here to replace doctors. This is something that we need to state straight away. It's here to enhance their ability to predict and prevent diseases. With models like AIR, doctors might one day be able to say, your ECG shows a high risk of heart failure in the next 5 years. Let's take preventive actions now. That's it for today. As always, I will see you soon for another tech adventure in healthcare.